So, well, in terms of COVID-related problems and so forth, so what we're tending to do is during sort of COVID, that we had restrictions to how much we could offer patients. So we were having to adapt the kind of procedures we had to do. So, I mean, as you may know, things like steroid injections, we lead back to the guidelines stated that we should not be giving steroid injections during the pandemic. But, you know, I had 3 cases during sort of just the month of April alone where I had a Zoom consultation, and, you know, it'd be classic. I was fine last night. I woke up and I can't move my shoulder and I'm in agony and I just don't know what to do. I've rung my GP and, you know, they've basically said take some Nurofen because, you know, the GPs weren't seeing patients. And this is quite a classic sort of history of calcific tendonitis, where, you know, patients were absolutely fine one day and wake up and they're in absolute agony. And it's unfair to ask these sort of patients to sort of stay at home and wait it out because, you know, they can't work from home. They don't have access to any kind of healthcare. So those kind of patients, although they didn't seem like, you know, they had a life-threatening injury, could easily be sorted out. So, you know, we saw them through the NHS, got them admitted. Well, not admitted, so had an X-ray, which sort of clinches a diagnosis. And we did a sort of ultrasound-guided barbotage, and it instantly improves their symptoms. So, although there are some conditions, you know, where we were sort of prohibited from sort of operating on them, you know, an ultrasound-guided barbotage for that kind of procedure was absolutely, you know, patients were really thankful for that.
Excellent. Okay, lovely answer. Rush, have you got anything to add to what's just been said, and perhaps a case study?
Yeah, we've had tons. I'm not sort of going to sit here and say actually COVID showed 2 amazing things: that you don't need manual therapy to get better. From the physio's perspective, you do not need any intervention from a physio to put their hands on you to get better. We've got countless case studies, and I'm not even kidding. We've got people who've helped from the start of lockdown, March, up until sort of say June, and they've basically worked through a tendon problem, or they've worked through some sort of shoulder problem. We've had dislocations that we've been managing to rehab, and going back to being able to play cricket, for example, through no intervention apart from effective rehab that's done with putting the patient in front of everything that we do. So I think a couple of things here that I think we've sort of moved away from is looking, like Dan said, as the pain. It's just a warning system that's designed by our body, and we need to appreciate that rather than sort of moving away from it. And then we've got a couple of other sort of issues that regarding like sort of things like steroid injections. Yes, they are very effective at certain times, given appropriately. And now I know there is a change in how surgeons are sort of going ahead with steroid injections, and we are actually referring patients to surgeons to get these steroid injections done because it is what's required for that particular patient. And you know, they've got protocols that they need to follow about self-isolating once they've had the injections. I believe Rupen and Dan can probably elaborate a little bit more on that. There's also talk on, you know, if we're looking at patient holistically, we need to identify what's happening best for this patient. If, like Rupen said, for this patient, you know, not being able to sit at a desk, and, you know, no amount of bracing, no amount of physio, no amount of virtual physio is going to change anything. It's about getting him straight to Rupen, get the injection done, and then sort of start thinking, right, a better rehab, and then sort of going forward. If I sort of wrap it up, I think what we need to understand about shoulder health is that it needs a collaborative approach, firstly. It just doesn't come just from the physio. It doesn't just come from the surgeons. It doesn't come just from the orthotists. I think there's that sort of collaborative approach. And with that collaboration, the patient should be right in the middle of it. And I think that's where healthcare has shifted now towards, and patients are much more educated. You know, they've got Dr. Google and they know exactly what's going on sometimes. And you have to appreciate the level of education they want to know, and it's empowering them again. You know, we had a model of healthcare that didn't necessarily work to the best of times, and now we're moving to one that will work. And I'd love to put out the question to Dan and Rupen as well. Like, you know, do you guys see the whole way you will be consulting change in the future with like face-to-face consults and virtual consults?
Yeah, absolutely. I mean, one of the things that I've found in the time of COVID is just being able to reassure people that what they've got is not going to overwhelm them, and it's not going to, it's as bad as it's going to get now. Don't worry, it'll get better. This is a natural history explanation. It's empowering people with knowledge and taking away fear and anxiety. Just those two things just help so much to be able to get a calm patient. You've got to calm them down. And I absolutely agree with you. I think, paint by numbers medicine and protocols is something we're moving away from when we're trying to individualize treatment within groups of therapists, and you have so much more impact if 2 or 3 different people are telling you the same thing, helping you along the same path. Those people feel as though they're being carried along through a journey of getting better, and it does a lot for their heads as well. So I think the days of a single person just doing one thing and doing it to everybody are gone. You're right.